Good evening. Today we are going to discuss about severity score of HRCT for COVID-19. Okay. So in there is total 5 lobes: upper lobe, middle lobe, and lower lobe, and upper lobe and lower lobe in left side. Each lobe of lung is given a score of 1 to 5 based on lung involvement. So 5, 5, 5, 5, 5. All three together combines to form score. Total maximum score is 25. Let's discuss what does it mean by these scores. Yes, if score 1, I can say score 0. If score 0 means 0% infected lung, a patient is absolutely fine, no involvement. If score is 5%, or if we can say score 1, it indicates 5% infection to the lung. If score 2, 5 to 25%, score 3, 25 to 50%, and score 4 indicates 50 to 75% infected, and score 5 means 75 to 100 or more than 75% infection of a lung. I hope it's clear. So 5 scores we give according to the stages. Score calculation is done based on each lobe involvement. Each lobe has maximum score 5, and so 5 lobes are maximum score 25. For example, score 5 means that the lobe is more than 75% involved or affected by coronavirus COVID-19. Now, if we calculate the score less than 8 by 25, so this is category into mild. If a score between 9 to 15, it indicates moderate CT severity. If a score is more than 5, then it indicates very severe. Okay, let's begin. CO-RADS. What is CO-RADS? It's the level of suspicion for COVID-19 infection. If CO-RADS 1 means no normal or infection, non-infectious abnormality. If CO-RADS 2 means low, abnormality is consistent with infection other than COVID-19. If CO-RADS 3, it indicates intermediate, equivocal findings for COVID-19 infection. If CO-RADS 4, it indicates high abnormality, suspicious for COVID-19 infection. If CO-RADS 5, it means very high, typical COVID-19 findings. If CO-RADS 6 means PCR positive. Okay. Now, what is CO-RADS? CO-RADS is categorical assessment scheme used for the reporting of CT patient suspected of COVID-19. It reports the level of suspicion for pulmonary involvement. For example, if CO-RADS is level 5, then there is very high chance of COVID-19. And this is the image of HRCT where severely infected lung. See, severely involved here. Image of HRCT, which indicates the COVID-19 coronavirus infection. So guys, I already explained 5 lobes. In upper lobe, 5 is for example, I give you some quiz. If there is involvement of 2 in upper lobe, then here involvement 3, and here 4, and this lobe involvement 1. For example, this is normal, you consider, and here involvement is 5. So total score 2 plus 3, 5, 5 plus 4, it's 9, 9 plus 1, it's 10, 10 plus 5, it's 15. So this is not the same picture, but 15 score out of 25. So this is categorized into moderate and severe. If score is less than 8, that means mild. If score is 19, that means severely infection, very severe. So score always mention on HRCT nowadays. If RT-PCR is negative but HRCT is positive, that means patient is corona positive. So I hope this video helps you to understand these scores. These are the CO-RADS classification. CO-RADS 4 means high, 5 means very high, and CO-RADS 6 means PCR, and CO-RADS means categorical assessment scheme for reporting of CT chest patients. Okay, and 3 is intermediate, 2 is low and 1 is no. Score less than 8 is mild, 9 to 15 is moderate, and more than 15 is severe. And score 1 indicates 5% infectivity, 5 to 25% is score 2, 25 to 53, 50 to 75 4, and more than 75 is 5. I hope guys this video helps you to understand the HRCT score. If you have any queries, and I am going to explain one thing more. Don't think this HRCT which I give the numbering score is same. Maybe here is very high score, maybe involvement here is nearly 4, in this lobe is 5, and their involvement is 5, and here is 4, this is 5. It's a very severe infection for this. So this score is given by radiologist, and my aim to explain here to understand HRCT COVID-19. Thank you. If you like my video, put like on it. Thank you guys.